In Aboriginal culture, certain customs and practices are performed by men and women separately, often referred to as men and women's business. Where possible, it is preferable for men to speak to men and for women to speak to women, especially in circumstances where you are not known by the person or community. It is important to ask if you're the only person available and of the opposite gender if they are okay to proceed.
So rather than being worried that a question that you're asking could be making somebody feel culturally unsafe because of men's or women's business, I'd be more concerned about the stuff that you're missing out on because you're opposite gendered to the person that you're treating.
For a clinician, a great way to gain trust is ask your client who they are and where they are from. Some strategies to help successfully work with Aboriginal people include listening without being judgmental. Incorporate healing therapies into your treatment, such as sand play and art therapy. Don't just use traditional talk therapies. Find the strengths within the individual. Aboriginal people have strong resilience. Working with Aboriginal community controlled services, such as your local AMS, and any other health services, including Aboriginal health within your local health district. Using interdisciplinary approaches that provide outreach services and transport. If a community is dealing with sorry business, it is respectful not to make any requests for a community meeting or consultation. Work with them to arrange the best possible times to meet. And most importantly, always ask if you are unsure of something. It is okay to ask.
Even having an Aboriginal painting up in a building, aesthetically, that can be a friendly gesture to say, we welcome Aboriginal people here.
Yes, the first contact is vital with Aboriginal people. If you don't have that first connection with them and you say to them, I'll see you in a month's time, you've lost them. Word of mouth is big here in town as well, and not just here, I guess it's everywhere. If you get a bad doctor in town or you're going to be mistreated or treated, disrespectfully, you're going to get bad feedback, especially from our elders.
Of course, if they've got a mental health issue, they have difficulty expressing themselves. So you've got to have a service provision that is open, and comfortable, and a setting where these young people feel like they are respected as who they are. Otherwise, there's a lot of shame talking about their mental health condition, and it gets held within for a long time.
We absolutely continue to use our professional skills, but we have to add to it. We have to try to add the knowledge of the Aboriginal community. We try to understand all communities and all races. The Aboriginal community is one that I think we grew up thinking we knew something about, but as the longer we interact with the community, the more we realise we're just lacking in that knowledge. But if you ask people, they tend to give it to you.
The reason for this video is to highlight the importance of incorporating culture into your therapy and service delivery. It is our responsibility to do everything we can to help close the gap for Aboriginal people.
It brings that concept to where as long as you stay healthy, you're staying alive, everlasting life.